Nutritional evaluation of preschool children in an urban community. Definition: nutritional status is characterized as an individual nutritional condition. Nutritional assessment is the systematic process of collecting and interpreting information in order to make decisions about the nature and cause of nutrition disorders. Application in nutrition. Nutrition is realized evaluation and interpretation from dietary quality, laboratory, clinical studies, and anthropometric that include body composition, physical activity, and anthropometric indices as weight for age, height for age, and weight for height. Nutritional clinical history provides this information and other factors with the purpose to detect deficiencies states, evaluate nutritional quality of diets, food habits, and prediction of health effects.
Hi, I'm Cian Safai, registered dietitian, and I'm here to talk to you today about your children's nutritional assessment. There are three things that we need to take into consideration when looking at the nutritional assessment of your child. The first thing is their height and their weight, how they're growing. The second thing is their nutrition, how they're eating. Third thing is physical activity. Are they doing anything? So anybody can design a chart like this. I just put this one together in a few minutes. It's got everything listed here and then some dates for you to track their progress if you'd like. I want to say a couple of things about growth because everybody seems to be so paranoid about their children's growth. Are they overweight? Are they underweight? Where are they compared to other children? The most important thing that healthcare providers look at is patterns of growth. We don't just look at one weight and one height. We look at height and weight over time and see is it tracking on the same line or is it spiking and peaking and falling? What's it look like? As long as your child is growing on a consistent pattern, that's a good thing. It's bad if your child is continuing to go up in terms of their weight or going down. And so that's why we need several different measurements. And you can work with your pediatrician to use the chart that's pertinent to plotting their weight and their height. The second thing that we need to look at is nutrition. And specifically, we need to look at there's 3 squares and 2 snacks, meaning their breakfast, lunch, and dinner, and their snacks. And most important in that is, are they consuming enough fruits and vegetables? Kids in our country do not consume enough fruits and vegetables, so we need to make sure that they're getting some of their every meal. The other thing that we need to look at, besides their nutrition, is we need to look at physical activity. Kids need to be active every single day. Less screen time, less TV time. So every single day between 30 to 60 minutes is the golden rule. Again, just a little check mark every day is all you need. So use this nutrition assessment chart and track your own child's progress and bring it with you to the pediatrician's office, or if you see a dietitian, give some very valuable information, and it should help you as a parent as well.
Pros, pros and cons. This method is not invasive, easy application, is economic, and is ideal for determining nutritional status of children. And cons, not everyone can do this practice and is a large method. Applied in Ecuador. Preschool children are the most affected group by malnutrition. In Ecuador, the prevalence of children with deficiencies of nutrients is 28%. MSP create programs to combat malnutrition problems through nutritional education, incorporation of pediatric nutritionists, and donation of food.
It was very overwhelming at first. What are we going to do without that easy prepared corn dogs and stuff like that? So we were first nervous about just finding things. Sometimes we struggle with, kids automatically think they don't like it because it's a vegetable or because it's green. So I think that's been a struggle.
When we have lunch, we sit down with the children, we do the family style, we try the food so the children know that all food is good. Because if we're not trying it, why would we ask them to try it?
We tackled one thing at a time. First, we stopped buying chocolate milk for the kids, and then we started with our snacks. After we had overhauled our snacks, then we started with breakfast, and then, of course, our dinner and lunch were last.
Now we do the family style where we used to serve the children their plates. Now they have family style where they serve themselves and they give them the the spoons for the amount that they have to have for each food group, which that's very positive. I like that change. It took a while for that transition because it takes a longer time for lunch, but we know the importance of doing it that way.
I think something that we have not completely but our full potential to is getting our families more involved. We hear little cases about people implementing stuff more, but I definitely think there is still um, that area that we can still improve on and work on. We have seen an increase in our expenses through the process. We're learning to shop at different places or get things on sale. My best piece of advice for folks who want to do this kind of work is to just keep trying. We have kids who try new things all the time. We have families who begin implementing some of these changes because their kids are learning about it and asking for it at the grocery store, and then to know that it's not going to be an overnight change.
Conclusion. Nutritional assessment represents one of the fundamental pillars of pediatric patients. In order to comprehensively assess their health status, implementing methods to evaluate the condition, nutritional helps in the prevention of chronic disease.